Learning Theory Movie by Patricia McCoy. This past fall semester, I participated in a learning moment in my workplace. We had a professional development seminar to attend hosted by our school guidance counselor. Our entire staff was involved in this event. It was all about trauma-informed care. The learning goal of this professional development was to learn how to better support students who have experienced adverse childhood experiences. According to ACEs Aware, trauma-informed care recognizes and responds to the signs, symptoms, and risks of trauma to better support the health and needs of patients who have experienced adverse childhood experiences and toxic stress. Based upon this learning moment, the main theories that underlie the learning that took place would be behaviorism and Maslow's hierarchy of needs. One of the reasons behaviorism was involved in the ACE presentation was because it discussed rewards and punishments. After reading Chapter 3 of Learning Theories and Education Perspective by Dale Shunk, behaviorism included the basic operant conditioning model that stated consequences that are reinforcing increase behavior, consequences that are punishing decrease behavior. Shunk 114. ACE affects highly externalizing behaviors in classrooms. According to the National Survey of Children's Health from Johns Hopkins University 2012, over 35% of students who exhibit external behaviors in classrooms have experienced 3 or more adverse childhood events. Due to this, our professional development advised that to help extinguish an undesired behavior, we can replace it with a desired behavior through reinforcement. This idea comes from B.F. Skinner's operant conditioning. Operant conditioning is based on the assumption that features of the environment, stimuli, situations, events, serve as cues for responding. Teachers are encouraged to evaluate features of environments in order to prepare for how to eliminate undesired behavior with trauma-affected students. In addition to behaviorism, trauma-informed care as a teacher is mainly rooted in the theory of Maslow's hierarchy of needs. Although our textbook did not mention this theory, its premise describes trauma-informed teaching perfectly. Maslow's hierarchy of needs included 5 tiers: psychological, safety, love and belonging needs, esteem, and self-actualization. According to Dr. Saul McLeod, needs lower down in the hierarchy must be satisfied before individuals can attend to needs higher up. With trauma-informed teaching, teachers are encouraged to meet the emotional and physical needs of students who have been adversely affected in life. One of the main principles of ACE is to create authentic relationships in a safe environment, similar to Maslow's hierarchy of needs. The greatest strength of behaviorism and trauma-informed teaching is that when there are specific goals to be met, the learner is focused clearly upon achieving those goals whenever there are cues to prompt the learner's behavior. Our school counselor advised our staff to set small goals for students and to provide visual cues when needed. These practices can help reinforce desired behaviors among adversely affected students. A weakness of this theory is that it implies it is not necessary to refer to underlying psychological or mental states to explain behavior. Shunk 114. whereas ACE reminds teachers to be considerate of students' adverse experiences that would affect physical and mental health. Learning might have occurred differently if constructivism was the foundation for teaching about ACE. This theory could help teachers understand that students who have experienced trauma need structure as well as choice. According to Dale Shunk, the key is to structure the learning environment such that students can effectively construct new knowledge and skills. This key structure would help adversely affected children by giving them the structure they need to learn new skills. A strength of constructivism in dealing with students with ACE is that the theory values students' point of view. According to the authors of The Heart of Learning and Teaching, compassion, resiliency, and academic success, students struggling with the effects of trauma need structure and high expectations. They need to be empowered to succeed. They benefit from having real choices and control. One might therefore reason that the student-centered model would be most effective. A weakness of constructivism in trauma-informed teaching is that it requires a shift in traditional teaching. As Shunk mentions, holistic teaching does not require sacrificing content, but it does involve structuring content differently. This could pose a problem for teachers because many teachers are conditioned to teach with a standardized curriculum, while constructivist teachers favor a more personalized approach. Although this could pose an issue, constructivist teaching ultimately would help students with ACEs and trauma because it would meet the students where they are at educationally and emotionally. Overall, my professional development in regards to adverse childhood experiences and trauma teaching was rooted in the theory of behaviorism. Constructivism could have made our staff's learning even more successful if the learning moment involved this theory. Both of these theories have great benefits as well as some weaknesses. In conclusion, although there are many educational theories that could influence teaching with children who have experienced adverse childhood experiences, it is up to the teacher to choose the best approach to receive the most successful outcome with the student.